It was Halloween day. Chloe just came home from school. She was in kindergarten. And prior to that, we sensed something was going on. I just remember that test strip, the color changing to show she was leaking glucose. It was like I've seen a ghost.
I think we were both in disbelief. It was a scary moment. She was formally diagnosed then with type 1 diabetes. It's a big shock to our family.
We became very scared.
We were pricking her finger quite often in the beginning.
Chloe herself having so small hands, the less needles that we need to give her, the better. The thing is, I want to protect her, but I also just want her to be a kid. It made it so much easier for us to manage Chloe's diabetes, knowing that we have the Dexcom G6 with us.
This has changed everything. Not having to prick her finger is amazing.
It gave us a feeling that we're in control of her diabetes. We're one step ahead.
So I open my zipper when it beeps, and I just press this button. There. Oh, well, what is it?
Quick and simple. As things progressed, our lifestyle didn't change. With us working about an hour away from Chloe's school, the Dexcom G6 follow app allows us to remotely monitor her glucose levels, gave us that greater sense of security, knowing that we would receive an alert if we needed to act. One of the benefits was her phone would notify her of an urgent low soon alert, which gives us leeway time to prevent that serious low and treat her before there's a significant event. Treating Chloe's diabetes always was a family affair. The ease of using the app is so intuitive that Caitlin can use it.
I think having Caitlin involved from the beginning, that's really helped.
They feed off each other and they can help each other get through things. The simplicity of the app allowed us to give Caitlin a sense of security, especially if we send Chloe and Caitlin to a sleepover. That right to childhood was something that we never took away.
She does exactly the same as her big sister. You know, if she's out or with family, she doesn't miss out.
And that's kind of how we decided to live our life. We can give Chloe the extra insulin and she can have that piece of cake. When Chloe was first diagnosed, the school was really great because they made Chloe having insulin an event. She would have to get insulin injections at school through a nurse. Kids would be like, can I go with her? Can I go with her? And they'd raise their hands. So Chloe would then feel that pride knowing that she can pick some kid in the class to come with her in order to get her insulin. Her diagnosis is not going to dictate how we live our life. It's not a doom and gloom situation. We are in control of it. Anything that a typical kid can do is what Chloe's doing right now. It's almost like someone took a blindfold off our eyes. Without the G6, we were oblivious to what was happening with her levels. It's not going to stop you from doing the things you enjoy. It's nothing to be afraid of. It's something that is manageable. You can actually be thriving with diabetes and live life to its fullest.
It's life. It's just what you've got to do.
I get to do everything I want to do.